Hello, my name is Scott Sterling, host of the AT Factor. Nearly the entire world accesses the internet, and has been estimated that about 90% of the world's population now has a mobile phone. In addition, social media platforms like Facebook and Twitter have 1.2 billion and 255 million active users respectively. Consequently, whether we like it or not, eHealth has entered our daily routine. Today, we'll be exploring the question, is eHealth the future or a fad? Today, I would like to introduce our panel. First, we have John Chapman, who is a senior medical librarian at Dartmouth College. Josh works with scholars in the medical profession to create, share, and exchange information, creating virtual communications and networks.
Thanks for having me, Scott.
Next, we have Jeremiah Bousteau. Mr. Bousteau obtained his master's in computer science from MIT and is currently the assistant director of information technology at the Northern Ontario School of Medicine at Laurentian University in Ontario, Canada. Jeremiah currently is developing a method for physicians to speak with at-home patients and provide care while also communicating to traveling nurses providing care to those patients.
Thanks for having me.
Okay. Then we have Catherine Tapesalot, who is an online journalist for CNN Health, your online resource for articles on healthy living, disease, and medicine. Ms. Tapesalot focuses on technology and the ever-changing world of healthcare.
Glad to be here. Thank you.
All right. Lastly, we have Lexi Bandini, who serves on the board of directors at a local high school, representing athletics.
Thank you, Scott.
First, we'll be starting with Mr. Chapman. This segment will explore the areas of social media and how it can help medical professionals in their everyday lives. We will first look at how Josh uses social media in his profession. Josh, we have a listener, Adam from Omaha, Nebraska, chiming in on Twitter asking, as a librarian, how do you help a healthcare professional that are not currently using social media, and what advantages does it have?
So I think Adam brings up a really important question, and that I see a lot in my setting, and that I come across individuals that are really reluctant to use social media in their clinical settings and really don't see a need for social media within their profession. So what I like to do is I kind of like to open the door to the possibilities to how it can better their communication with other healthcare professionals, and how social media can deliver information in a different form that can be more convenient for them. So I first kind of like to find out what the individual wants to connect with, and then I suggest to these individuals that to use one type of social media, not kind of explore many different ones, kind of pick one that they feel comfortable with, and then exploring the disadvantages and advantages of that one, and then kind of branching out into different social media networks after that.
All right, so our next question comes from a listener, Alex Friedman, and he asks, as an athletic trainer, how can I use social media, and what communities would interest me?
So I actually get a lot of athletic trainers using our resources here at Dartmouth, and this is a common question that I usually get. So there are a lot of great resources that post to social media networks like Facebook and Twitter. For instance, I actually came across an article last week from the New Hampshire Musculoskeletal Institute that posted on Facebook about the NFL leaving out more than about 100 reported concussions in their annual reporting of concussions, and this is a very staggering statistic that I found. And this could be something that interests the general public and athletic trainers. However, they may have missed this if they didn't have that connection through social media. It was basically left out of the mainstream media. So that's kind of an area that can help certainly athletic trainers and general public in general. The British Journal of Sports Medicine is also another great resources to use. They have their own blog, they have their own podcast, as well as they typically post several articles onto Facebook and Twitter. So that's another one that I would suggest athletic trainers use. And then there's also many communities available via social media.
It seems like there's a lot of great resources out there for athletic trainers to utilize. Let's move on to our next question coming from Andrew Lawrence from Boston, Massachusetts. He asked, how can social media improve communications with my patients?
So this is an area where many healthcare professionals really don't utilize, and they may not actually know that this area of social media actually exists. So a couple different things that I kind of like to recommend to them is that clinicians can use Facebook and they can create lists, and then also Google Plus you can make circles, and these can be specifically for patients. So you go in there, you make a list, and you can communicate with these patients, and you can disseminate information like guidance on rehabilitation exercises, reminders to take medication, reminders of certain treatment times that you might have. So that's something that I always like to recommend to clinicians to actually utilize. Also, Skype is another social media network that I like to recommend. This can be really used for many different things, and it's really up to the clinician to find out how they can actually utilize this social media network. So what I like to recommend is they can do real-time clinical evaluations, or if they need to follow up with a patient, they can easily do that over Skype. I think the most important thing to recognize or to think about before you start using social media, though, is to make sure that it's HIPAA compliant. So you want to make sure that it's HIPAA compliant, you're not violating any laws, and to create a safe environment for both the clinicians and your patients.
Thanks, Josh. Your insight on how social media can be utilized to help the clinician has been very helpful. Our next segment is going to focus on mobile communication, and for this we're going to turn to our expert, Mr. Gusto. So our first question comes from Angelina Babinski, who serves as the head athletic trainer for a high school in Delaware, who posted on our Facebook just a few minutes ago. Angela asks, is there a system I can use to communicate with my coaches and physicians more effectively? I like that my electrical medical records functions for medical documentation, but I want to keep my coaches informed and send out an injury report. I also would like to communicate with my team physicians pertaining to what is going on with my patients.
That's a great question, Angela. So I think one of the great things about online communication is that Google is the paramount of most of it. And we're even communicating and doing this panel through Google. And Google Drive has a HIPAA-compliant option. You just have to sign in under a Google app work account and be under the administrator account for that account. So your business can have a specific account for Google Apps that can be used specifically for your sports medicine facility or for your medical facility, but the user has to sign in under a business associate agreement, so a BAA, in order to keep all of the protected health information or the PHI safe. So all of the users can access this small section of the core services, which are the main Google apps, and the PHI will be protected under HIPAA through the BAA as long as the healthcare organization configures the services to be HIPAA compliant. So you have to make sure only specific individuals have access to certain documents, certain drives, but this includes your Gmail account, Google Drive, which includes docs, sheets, slides, forms, Google Calendar, and Google Sites. So all of these can be utilized with a small fee and will be completely HIPAA compliant, so you can keep in contact with your coaches, your physicians. You can even send presentations to your athletes. Have an entire folder just for coaches of different sections, just making sure that those individuals don't have access to other areas by configuring it in that way on the administrator account. Functions that aren't really permitted with the use of PHI and aren't HIPAA protected are Hangouts, contacts, and groups, because the other individuals involved in the section. So as long as you don't have these individuals compounded into the contacts and you send out your contact list to the entire group, then you should be okay. It's your responsibility as the user to not share the PHI in those specific functions.
Thank you, Jeremiah. One last question for you. It comes from LaShawn Rubio, a licensed physical therapist and athletic trainer from Asheville, North Carolina. They called in ahead before the show and asked a question about communicating with patients. He said, I only see my patients once every 1 to 2 weeks. I want to be more engaged with their at-home rehabilitation. My patients rarely read the emails, but they respond to my phone calls. Is there a more effective way to communicate with my patients on an individual basis?
Yes, definitely. I also run into the issue where some people don't answer my emails, and I'm not really sure where to go from there. But if you have the ability to contact your patients via their mobile phone, you can actually send a text message to them through the sort message service or an SMS. And many people are familiar with SMS. There are multiple methods through which text messaging can be accomplished. And if your place of work provides you with a mobile device that's separate from your own personal device, you can use this mobile device to contact your patients. And systematic reviews have found that SMS messages can positively impact personal health behaviors, including diabetes, self-management of weight loss, physical activity increase, smoking cessation, and medication adherence for various therapies, as well as chronic disease and management and prevention, which would be very beneficial in a physical therapy setting such as yours. So it's important to remember that when messaging patients, we have to focus on the key aspects. Anyone can take a message and contort it the way they want, but as long as you write the message in the way that you want it to be intended, then it will be coming across to the patient in that same way. So a clinician has to start with a positive outlook. You have to remember that the patient is a person first. Then ask them how they're doing and encourage them and add any recommendations or insights towards their treatment goals or their needs. And then the encouragement has to come before any negative connotation. Additionally, the patient should be praised for following the clinician's orders. And if they're doing something right, you should let them know. The patient should also be never rushed into doing an appointment or coming immediately. This will probably scare them, and they'll freeze up and become anxious of their next appointment. It would also be wise not to send any reprimands to your patients for not completing a task. Instead, send reminders or ask if the tasks have been completed. Make sure that you get rid of adjectives such as good or bad from a message if it includes results, so that way you can encourage a positive health behavior. And lastly, the thought and meaning of the sender should match the thought of the receiver, as I stated before. So be sure that when you read your message multiple times before you send it, make sure that none of the information can be taken out of context and that the meaning of your message is fully conveyed towards its original intention. So, for example, an idea of a text message I might send if I was a physical therapist would be, hello, I hope everything's going well for you today. You're doing a great job with your rehabilitation so far. Don't forget to take your medication. Also, we got back your MRI results, and we'll discuss them with you at your next earliest convenience so we can speak on potential progress. Please let me know if you need anything.
That text message sounds great. What is your stance on messaging apps specifically?
I think simple text messaging is effective, but applications on smartphones, specifically the WhatsApp, that's a great application, can allow a clinician to contact their patients through the app using SMS without having to rely on a satellite signal. So you only need an internet connection, which makes it very applicable to connecting from anywhere, even if there is a landline or phone that's able to be contacted if you're wanting to contact your patient. It does limit the number of individuals you can contact because those individuals have to have a smartphone or they have to have the app in order to be contacted, but you can make your own judgment on which app you would use or if you would contact the patient directly or even use an application at all. So I hope you can provide more insight, Catherine, onto the app world, as that's your expertise.
So that's a great segue into our next section. The following segment is going to be focused on mobile apps and their use in providing information on assessment, treatment, and prevention of sports-related injuries. For this segment, we will look at Catherine Tapesalot, who recently researched this very topic. Catherine, your first question comes to you via Facebook from a concerned high school sports parent in Ohio. It's become more and apparent that there is an app out there for everything. Do you have any concerns about who will be using apps regarding medical assessments and treatments?
Yes, I understand that concern, and I really think there are two concerns happening here. There's the concern for the clinicians specifically searching for quality apps to provide their patients, and then there's also the concerns of the patient that they will be provided misinformation from anyone and everyone in the community who has access to these things. There's obviously a huge market for apps, and there are many available that do not have evidence-based content. For the sake of medical professionals, there really needs to be some kind of way to certify these apps so they know they're providing patients with quality information from a source they can trust. The British Journal of Sports Medicine actually did this recently by openly supporting what's called the ankle app, which includes evidence-based preventative ankle exercise program. And I'm thinking that hopefully the British Journal of Sports Medicine will kind of start a trend for other organizations to do the research on these apps and provide the medical community with safe options. There are other apps available that assist clinicians in like simple evaluation techniques, like an iPhone goniometer, which can improve efficiency for collecting objective data for the clinician. And there is some research to suggest that those types of things are reliable as well. In regards to the second concern, the open availability of apps that have medical information, assessment, and treatment does raise some concern for less qualified individuals using this information inappropriately. What I think is important for healthcare professionals to do is to educate patients and the general public about who they should be getting medical information from as this e-world or e-health world continues to grow. Hopefully, as more quality apps are developed, awareness will be spread that these are not developed for self-treatment and should not replace the medical advice you typically seek out.
Hopefully that answers your question. Thanks for your input, Catherine. Your next question is coming from John, athletic trainer in California, via Twitter. John asks, concussions are clearly a major topic in athletic training. Are there any apps that clinicians can use to aid in the diagnosis, documentation, or treatment of concussions?
Yeah, when I first started researching this topic, those were kind of the things that popped up first. So if you type in Concussion App, even into your iPhone App Store, tons of options for attempting to diagnose or recognize a concussion show up. And I think for the majority of them, the intention is good, but not very many of them are validated or researched at all, which confirms the recent systematic review from the British Journal of Sports Medicine. In this review, content for certain apps were compared to the SCAT-2 as the standard for concussion assessment. And many apps ranged in their level of compliance compared to this standard. It's also important to note that the audience each app was targeted varied from the general population to physicians, athletic trainers, and each of that targeted population would obviously change what kind of information was provided. Results of the review showed that only the original SCAT-2 Sport Concussion Assessment Tool app was compliant compared to the gold standard, which would now be the SCAT-3 since it's published. The Impact company, if anyone's familiar with that, has also developed an app that can take some background information on mechanism of injury and symptom score before allowing you to access the neuropsychological tests and baselines, which can be a useful sideline, like quick documentation option as well for clinicians. Overall, I think apps on concussion assessment need further research and developed to mimic the gold standards. It's important as a clinician not to replace your typical concussion assessment and documentation protocols at this time. Interestingly, though, there's one particular article that I liked that I read recently, developing an app to deliver the best test called IVES Metric. The best test is for postural stability. It is commonly used for concussion assessments, is now recommended by the NATA to be implemented during concussion assessment, and in general even better as a baseline measure. The best test is a 3 balanced stances on firm ground and then again on a foam surface, typically judged on an error scale by a clinician. In this study, an iPad was actually placed at the sacrum and compared to a 3D motion sensor to test the sensitivity for detecting postural sway. The iPad app had an accelerometer and a gyroscope, which is how it measured those things. The results showed that sufficient quality of motion capture was obtained by the iPad app to quantify postural stability in healthy young adults. Having an effective app like this might actually improve the efficiency and increase the number of clinicians using these types of apps as baseline tests in PPEs or before sports season start. Although the population in this particular study was healthy, not concussed, and further research is obviously needed, I think it's studies like these that really begin to bridge the gap between a good idea and evidence-based e-health.
Sounds like there's some promising information on future mobile apps for concussion assessment. We have one last question about mobile apps coming to you from a team physician working with a semi-professional women's soccer team in Arizona. They ask, I think clinically injury prevention can be difficult to implement on a large scale. Are there any apps that may be helpful, that may help athletes take more interest and accountability for prevention programs?
Yes, I think that's a great question. And in the healthcare field, I think they're getting particularly interested in apps that focus on prevention or rehabilitation programs for sports-related injuries. Another recent review, actually, that came out from the British Journal of Sports Medicine sought to determine if any prevention apps that are already out there had any scientific evidence to support their content. Their findings showed that only 4 of the 18 identified apps had information that evidence could support. The 4 apps with scientific support covered topics of ankle sprains, typically taping and neuromuscular training, prevention of dental injuries, and an exercise routine to prevent ACL injury. The article did discuss that 5 apps specifically contained false claims, further supporting the need for regulation and certifying of apps that are out there. I think it's important for researchers to continue to analyze whether preventative claims made by these apps have available evidence to support them. This may lead to more apps like the ankle app that clinicians can trust knowing it comes from a place like the British Journal of Sports Medicine. If we can get more research and evidence-based apps, I think we can provide users and our patients with tailored information and the added ease of self-monitoring like you suggested, and then we would be able to implement prevention on some larger scales.
While we see the many advantages of eHealth, there are also a number of drawbacks associated with it, just like Scott said. So looking at research, one of the first things is there's a concern that eHealth tools can only reach a digitally literate population. So our generation is much more accustomed with the use of electronics, and we can pretty much navigate our way through any electronic device or software for the most part. But when we consider the older population, like our parents, grandparents, or maybe even great-grandparents, they might have a more difficult time trying to navigate through whatever electronic they may be using. They didn't grow up with it as much as we have, this causing them not to be as digitally literate as we may be. The time it may take them to complete something electronically may take significantly longer than a youth. So first just trying to figure out how to type everything in and then probably having to ask many questions because of some confusion. Arguably, this may become less and less of a problem, whereas digital access and digital literacy continues to mature. The second one we look at is validity issues continue to pose a reason for concern, right? So often what happens is that a traditional paper questionnaire is simply digitized, neglecting the fact that text is read differently on screen than on paper. So on-screen reading is defined by short and concise text, while paper reading allows for longer paragraphs. Along with this, when using online surveys, some people may perceive the email as possibly junk mail, or it might just go straight to junk mail, so the individual will never even look at it. The last one we look at is through branching. The interpretation of some questions might get lost while a subset of questions remains hidden for the respondent after a specific answer.
Thank you for that information. Your first question comes from Bailey, texting in from Denver, Colorado, asking, do you believe there is a way to overcome the barriers to eHealth? If so, how do you see that happening?
Well, yes, I do. If we look at the specific examples I gave, there can definitely be some ways to overcome them. So when I was discussing the online surveys, I mentioned how some recipients may perceive the email as junk mail. The problem with this could potentially be reduced if online surveys are opt-in rather than sent in an unsolicited manner. So they should still have the option to opt out as well. In addition, the contact email should be short and direct the respondent right to the survey URL. Another barrier that I focused on was the population that's not very digitally literate. I would say that this will decrease over time because it's more focused on the older population. So nowadays, most of us are all using some kind of technology, including an electronic device. So over the years, eventually, most individuals will have some kind of experience with technology.
In closing, I would like to thank our panel for providing our listeners with insightful and thought-provoking explanations about the possible advantages and disadvantages of eHealth. It's important that eHealth, it's apparent that eHealth does have the ability to connect our community, patients, athletes, and healthcare professionals, but to what extent is still unclear. If you would like to weigh in on the pros and cons of eHealth, please go to our Facebook page, the DAT Factor, and write your comments in eHealth Future or Bad, or on Twitter at #the DA Factor eHealth. We look forward to hearing what you have to say. The DA Factor has been brought to you by the Doctorate in Athletic Training Cohort, class of 2017 at Indiana State University.
Hello, my name is Ethan Roberts, and I played the part of Josh Chapman, and I'm also a Doctorate of Athletic Training student at Indiana State University.
My name is Nicolas Merritt, and I am a student at Indiana State University's Doctor of Athletic Training program, and I played the part of Jeremiah Bustillo.
Hello, my name is Dustin Anderson. I'm a Doctorate in Athletic Training student at Indiana State University, and I played Scott Sterling in the DAT Factor.
Hi, my name is Chelsea Toney, and I am in the Post-Professional Doctorate in Athletic Training program at Indiana State University. Today, my character was Lexi Bandini.
Hi there, my name is Jamie Nicander. I am currently a Doctorate in Athletic Training student at Indiana State University, and for this online talk show today, I played Catherine Tapesalot, the CNN journalist. Thanks for watching.